This PowerPoint is a fundamentals review that can be used to prepare for the HESI. The nursing process, this slide is pretty much straightforward. We're just talking about how the nursing process is really woven throughout everything that we do, and it just goes through the steps of the nursing process on this page. So just make sure that you understand and review this information. When we're talking about professional standards, we talk about definitions like autonomy, which refers to freedom from external control. The patient does have the right to accept, refuse, or terminate care with autonomy. Beneficence is to act in the best interest of others. Nonmaleficence is do no harm. Justice is fair, equitable, and appropriate treatment. Resources are equally distributed among all in the term justice. Fidelity, that's keeping commitments and promises and unwillingness to abandon patients regardless of the circumstances. Advocacy refers to the support of the patient, the nurse's primary commitment to the patient, individual, family, group, or community. Responsibility, that obligates a person to accomplish a task. With delegation, you are responsible for both your own actions and the actions of those to whom you delegate tasks to. If orders are inappropriate, the nurse should question and clarify the orders. The nurse is responsible for knowing pharmacological principles, drug interactions, and proper dosages. Accountability is accepting the ownership for results or lack of results. You're accountable for the nursing action that you take. Confidentiality is to maintain the privacy of the client, non-disclosure of data or personal information. The person performing the procedure is required to obtain the informed consent. Assault would be communicating a threat, where battery would be intentional touching without consent or lawful justification. Slander occurs when one speaks falsely about another, and then libel is the written defamation of character. Negligence is contact that falls below the generally accepted standard of care of a reasonably prudent person. Malpractice is professional negligence. Using silence gives patients an opportunity to collect and recognize or organize their thoughts. Silence prompts some people to talk, especially therapeutic during times of sadness or grief when you're providing presence. Hearing impaired, face the patient, reduce environmental noise, speak at normal volume. Don't assume a patient who is nodding yes understands. Make sure that you confirm understanding. Visual impairment, identify yourself when you enter or leave a room and make sure that there's adequate lighting. Cognitive impairment, use simple sentences and avoid long explanations. Patients with stroke, ask simple yes-no questions. And use communication aids like picture boards, use gestures. Let the patient know if you don't understand. Allow for understanding response. Patients who are unresponsive, make sure you communicate both verbally and by touch. Explain all procedures and provide orientation. When we talk about factual, we're talking about charting objective data, and that would be the information that we can gather using our five senses. It is either a measurement or an observation. For example, blood pressure, lab values, assessment. Avoid vague terms such as appears or seems or apparently. Describe behavior, don't interpret. For example, don't chart patient combative. Rather, patient attempting to hit and bite nurse. The only subjective data that you include in your record is what a patient says, using quotation marks whenever possible. Accurate, make sure that the use of exact measurements Don't chart urinated adequate amount, chart actual amount of output. This establishes accuracy and helps you determine if a patient's condition has changed in a positive or negative way. It is essential to avoid the use of unnecessary words and irrelevant detail. Use correct spelling and proper use of abbreviations per your facility policy. Complete means that it contains appropriate and essential information. You frequently use flow sheets or graphic records to document routine activities such as daily hygiene care, vital signs, and pain assessments. Make sure it's current. Documentation needs to be current, so timely entries are essential in a patient's ongoing care. Delays in documentation lead to unsafe patient care. Most healthcare agencies use military time. Sexuality in older adults would be risk of STIs because risk of pregnancy is not an issue. They don't think about the STIs. They just think that their partner cannot get pregnant. Often they do not recognize the need for protected sex. Pathological issues with the aging sexual response are often related to illnesses and side effects from medication. Older adults are often reluctant to dismiss sexual problems with healthcare providers. Faith, it provides confidence in something for which there is no proof, and hope is present when a person has something to live for or look forward to, and a religion is the system of organized beliefs of worship. This slide talks about loss, death, and grief. Make sure that you go in review box 37-4 on page 757, and then also review table 37-3, page 763. Airborne precautions, remember they're spread through the air. Tuberculosis is an example. Private room, make sure they have a private room with that negative air pressure. And the nurse must wear an N95 respirator. The patient wears a surgical mask if required to leave the room. Under droplet precaution requires the wearing of a surgical mask when within 3 feet of the patient, such as influenza. The patient wears surgical masks for transport too. Contact precautions requires gloves and gown for infection that is spread by direct or indirect contact like MRSA or VRE. Standard precautions apply to contact with blood, body fluid, non-intact skin, and mucous membranes from all patients. Remember, a sterile object remains sterile only when touched by another sterile object. Only sterile objects may be placed on a sterile field. A sterile object or field out of range of vision or an object held below a person's waist is contaminated. A sterile object or field becomes contaminated by prolonged exposure to air. When a sterile surface comes into contact with a wet, contaminated surface, the sterile object or field becomes contaminated by capillary action. Fluid flows in the direction of gravity. The edges of the sterile field or container are considered to be contaminated. The temperature obtained varies depending on the site used, but it is usually between 36 degrees Celsius or 96.8 degrees Fahrenheit and 38 degrees Celsius, which is 100.4 Fahrenheit. With rectal temperatures, they're usually 0.5 degrees Celsius or 0.9 degrees Fahrenheit higher than oral temperatures. Older adults have a slightly lower body temperature. Nursing interventions for fever are monitor vital signs, intake and output, and skin color and temperature. Also monitor WBC count, hematocrit, or other lab indicators of dehydration or infection. Remove extra blanket when client feels warm, but provide warmth when they are chilled. Provide adequate nutrition and fluids between 2,500 and 3,000 milliliters daily to meet increase metabolic demands, and prevent dehydration. Administer antipyretic medicine as prescribed. Limit physical activity to prevent heat production. Tepid bath to increase heat loss by conduction, and provide safety measures if the patient is disoriented from the fever. Remember RACE: rescue, remove client from danger, activate the fire alarm, contain the fire, and extinguish if possible. Remember restraints used as a last resort after trying alternatives. You do need a physician order. Do not attach to movable part of the bed. Remove restraints every 2 hours to allow for exercise, toileting, and to check the condition of the skin and circulation. Skin care, make sure you avoid too frequent bathing and use of hot water. Apply moisturizers, clean skin regularly, and at time of soiling, avoid friction, lubricate dry lips. Common factors that interfere with sleep: heavy meals just prior to bedtime, caffeine, nicotine or other stimulants, environmental factors such as light, noise, and television. Remember OSA, major risk factors for obstructive sleep apnea or OSA are obesity and hypertension. Symptoms are snoring and excessive daytime sleepiness. Priority assessment would be the respiratory system. Health promotion is to improve sleep. This is the way that we can do that. Environmental factors such as the mattress that provides support, the room temperature needs to be a good room temperature, minimal noise, dark room, nightlight for infants and older adults. Promoting bedtime routines, avoid excessive stimulation just before bedtime. Associate bedroom with sleep and sex only. Consistent time for sleep and awakening helps to promote better sleep. Also, stress reduction. If unable to sleep in 15 to 30 minutes, get out of bed. Reading, relaxation activity rather than staying in bed and thinking about not sleeping. Bedtime snacks can promote or can improve sleep as well. Those would be dairy products like warm milk that contains L-tryptophan is often helpful. No caffeine or alcohol before bed. That can cause awakening during the night and can act as diuretics. Remember with the NG tube that we do check placement by x-ray. We can check it to see if we think they're in the stomach by the measurement of the pH, but you must get a chest x-ray to confirm placement, especially before you use it. Complications would be complications with TPN would be catheter sepsis. If that happens, you want to make sure you change TPN infusion tubing and TPN bag every 24 hours. Lipids, no more than 12 hours. Electrolyte imbalances can also be a complication. Hyperglycemia, you need to monitor blood glucose every 6 hours. Insulin also may be required. Fluid overload can be a complication of TPN, and then sudden discontinuation can cause hypoglycemia. Make sure that when you are discontinuing TPN that there is an order to infuse 10% dextrose when we're discontinuing. Urinary retention. Make sure you assess for bladder distension. Signs and symptoms of a lower UTI, remember, are burning or pain with urination, dysuria, urgency, frequency, and foul-smelling cloudy urine. So the first symptom of a UTI in the elderly may be confusion. Also, patient education for a healthy bladder would be drink 6 to 8 glasses of water a day, avoid beverages that contain caffeine or alcohol, avoid drinking fluids 2 hours before bedtime, and void at regular intervals every 3 to 4 hours. Preventing UTIs, we want to make sure that we are teaching our patient perineal hygiene, void at regular intervals, voiding after intercourse, not using excessive soap or taking bubble baths, wearing cotton underwear, and drinking acidic fluids such as cranberry juice can help to prevent UTIs. Urinary incontinence on a patient may cause reddened, irritated skin on the perineum. If we're talking about transient incontinency, that is caused by a medical condition that may be reversible, like acute confusion or an UTI, or maybe a fecal impaction. Functional incontinence would be as a result of a cognitive, sensory, or mobility issue, not a problem with the urinary tract. For them, we do time voiding every 2 to 3 hours for the cognitively and mobility impaired adult. Stress incontinence would be caused by coughing, laughing, lifting heavy objects. Intervention for that would be pelvic muscle exercise like Kegel exercises. That's explained on page 1118, box 46-8. Urge incontinency would be urgency, leaks on the way to the bathroom. Interventions for that would be avoid bladder irritants like caffeine and alcohol, bladder training, which would be increasing intervals between voiding. Reflex incontinence, that's related to spinal cord damage, they're not aware of their bladder filling and the urge to void. Intervention, often intermittent catheterization, is used. Factors influencing bowel elimination would be age, diet, fluid intake, needs to be 2,000 to 3,000 milliliters a day, physical activity, psychological factors, personal habits, positioning during defecation, pain, pregnancy, surgery, and anesthesia. Paralytic ileus may last 24 to 48 hours after abdominal surgery. Medications can also influence bowel elimination. Constipation definition would be less than 3 bowel movements per week. Causes would be improper diet, reduced fluid intake, lack of exercise, and certain medications can cause constipation. Causes of constipation is on page 1152, box 47-1. What are some signs of dehydration? Dry skin, dark concentrated urine, less frequent urine than usual, thirst, decreased skin turgor, tinting, fatigue, and dizziness. One of the most important habits to teach regarding bowel habits is taking time for defecation. Advise the patient to begin establishing a routine during a time when defecation is most likely to occur, which is usually an hour after a meal. When patients are restricted to bed or need to ambulate, often a bedpan or help them reach the bathroom in a timely manner. So either offer them a bedpan or help them go to the bathroom. It is important to provide privacy. Always place the call light and toilet tissue within the patient's reach. When patients are at risk for falls, stand near them or leave the door partially open so you can see them at all times. Assist patients who have difficulty sitting because of muscular weakness and mobility problems. Place an elevated seat on the toilet when patients are unable to lower themselves to a sitting position because of joint or muscle wasting disease. These seats require patients to use less effort to sit or stand. Digital removal is a last resort in the management of severe constipation and is practiced when all other methods have failed. The procedure is very uncomfortable for the patient. Excessive rectal manipulation causes irritation to the mucosa, bleeding, and stimulating the vagus nerve, which results in a reflex slowing of the heart rate. Because of the potential complications of the procedure, a healthcare provider's order is necessary to remove a fecal impaction. Ostomy bags need to be emptied when they are 1/3 to 1/2 full. The pouch is changed every 3 to 7 days. Cleanse the peristomal skin with warm water. Soap can irritate the skin. Assess the stoma color. It should be pink or red. Observe the skin for any signs of irritation or skin breakdown at each pouch change. Patients with colostomies have no diet restrictions. Patients with ileostomies will digest their food completely but will lose both fluid and salt through the stoma and will need to be sure to replace this to avoid dehydration. Hypoventilation is characterized by a decreased respiratory rate or effort. As ventilation decreases, the body retains carbon dioxide. Signs and symptoms of hypoventilation include mental status changes, dysrhythmias, and potential cardiac arrest. If untreated, the patient's status rapidly declines, leading to convulsions, unresponsiveness, unconscious, and death. Causes would be secondary to a central nervous system depressant drug that slow down the respiratory system, neuromuscular disease that cause weakening of the muscles that control breathing, broken ribs can also be a cause. Hyperventilation is caused by severe anxiety, infection, drugs, or acid-base imbalance. Signs and symptoms of hyperventilation include rapid respirations, sighing breaths, numbness and tingling of hands and feet, lightheadedness, and loss of consciousness. Hypoxia would be an inadequate amount of oxygen transported to the tissues. Normal would be greater than or equal to 95%. Causes would be diseases such as anemia, carbon monoxide toxicity, pulmonary edema, heart failure, pneumonia, or drugs such as anesthetics. In the early stages of hypoxia, the patient is often anxious and restless. They're unable to lie flat. The patient's vital signs may also vary from baseline, with heart rate, respiratory rate, and blood pressure all elevated. Late signs of hypoxia are confusion and cyanosis. Where do you assess for cyanosis from hypoxia? That would be the lips, the mucous membranes, the tongue, and conjunctiva. Oropharyngeal suctioning is a clean procedure, remember. The other types of suctioning use sterile technique. When suctioning a tracheostomy, the patient should be hyperoxygenated first. When suctioning, you apply negative pressure of 120 to 150 millimeters of mercury during withdrawal of the catheter, never on insertion. Rotating the catheter enhances removal of secretions that have adhered to the sides of the ET tube. The entire procedure from catheter passage to its removal is done quickly, lasting no longer than 10 seconds. Acute pain may have physiological symptoms such as tachycardia, increased blood pressure, fear, anxiety, whereas chronic pain, often not a definite cause, can cause depression, fatigue, hopelessness, and it does affect their quality of life. Medications that can be used for pain medication other than opioids would be NSAIDs, tricyclic antidepressants, anticonvulsants, and muscle relaxants. Non-pharmacological methods would be TENS unit, heat and cold therapy, distraction, relaxation, biofeedback, massage, and acupuncture. Crutch walking and gaits used would be the 4-point gait that gives stability to the patient, but it does require weight bearing on both legs. Right crutch, left foot, left crutch, right foot. Use of a 3-point gait for non-weight bearing status on one leg. The affected leg does not touch the ground during the early phase of the 3-point gait. Crutches and bad leg advance together, then the good leg. 2-point gait requires at least partial weight bearing on each foot. The patient moves a crutch at the same time as the opposing leg, so the crutch movements are similar to arm motion during normal walking. Individuals with paraplegia who wear weight supporting braces on their legs frequently use what's called the swing-through gait. With weight placed on the supported legs, the patient places the crutches on one stride in front, and then swings to or through them while they support his or her weight. Stairs with crutches, always remember up with the good leg and down with the bad leg. These 6 factors contribute to pressure ulcer formation. Patients with altered sensory perception for pain and pressure are at risk. They cannot feel their body sensations. Patients who are unable to independently change position are at risk because they cannot change or shift off of body prominences. Patients who are confused may feel pressure but aren't always able to understand how to relieve it or communicate their discomfort. Shear force is the sliding of movement of skin and subcutaneous tissue while the underlying muscle and bone are stationary. Shear can be avoided by keeping the head of the bed at a lower angle. Friction is when two forces rub together. For example, a restless patient continuously rubbing his feet across the sheets would be an example of friction. Appears as an abrasion or a sheet burn sometimes. Prolonged moisture softens the skin, making it more susceptible to damage. Problem with urinary or fecal incontinence. Remember, dehiscence is the partial or total separation of wound layers. Obese patients have a higher risk of wound dehiscence. Can occur in abdominal wounds after coughing or vomiting. Teach your patients splinting with a pillow when getting out of bed and while coughing. Now, evisceration would be the protrusion of visceral organs through a wound opening. Remember, evisceration is an emergency. Immediately place sterile gauze soaked in sterile saline over the site. Contact the surgical team. Do not allow the patients to have anything by mouth. They will be NPO, and then observe for signs and symptoms of shock and prepare the patient for emergency surgery. Nutrition. Patients need vitamins A and C, calories, and proteins to heal. They need 30 to 35 kilocalories per kilogram per day for normal wound healing. Protein needs are especially important for patients with wounds. Collagen is a protein found in the dermal layer of the skin. How do you assess if this is adequate? You would check serum albumin and prealbumin. They're labs used for nutritional assessment. What do you do if a coworker has an emergency and asks you to administer medication she has prepared? You will not do that. Make sure that you only give medications that you prepare. A patient has a right to refuse medication regardless of the consequences. What do you do if a patient refuses the medication? You're going to determine the reason, educate the patient, document, and notify the physician. Can you ever give a patient a placebo? No. You cannot ever give a patient a placebo. If they are part of a research study, then they would know. They must know. Oral medications, make sure you break only the scored tablets. Crush only medications approved for crushing or chewing, non-enteric coated, sustained release, or XR. Skin applications. Make sure you apply gloves, remove prior applications, rotate application areas to prevent skin irritation. Apply to a clean, dry, intact, hairless skin on the arm, chest, or upper back. With eardrops, adults pull auricle up and back. In children under 3, pull auricle down and back. With eye drops, ask patient to look up. Pull down the lower lid. Administer to center of conjunctival sac. Apply pressure to their inner canthus to avoid systemic absorption of medication. With eye ointment, apply from the inner canthus to the outer canthus. With rectal application, make sure that you have the patient in the Sims position or left lateral. Apply water-soluble lubricant, and with the adult, insert approximately 4 inches. With a child or infant, insert approximately 2 inches. Intradermal injections. Do not aspirate. Inject at a 10 to 15 degree angle, bevel up. Observe for wheal formation. 0.1 ml is the maximum volume. 3/8 inch, 25 to 27 gauge needle. With our IM injections, do not aspirate when administering vaccinations. Aspirate other IM injections. IM sites recommended for greater than 2 ml would be ventrogluteal and vastus lateralis. Site for vaccinations, immunizations would be the deltoid. Syringe and needle sizes for an insulin would be 1 ml maximum volume, 3/8 inch, 29 gauge, inject at a 45 or 90 degree angle. The deltoid, use 5/8 inch, 23 to 25 gauge. Other IM sites would be 1.5 inches, inject at a 90 degree angle. Complications of IV therapy include circulatory overload, infiltration, and phlebitis. Fluid volume deficit, sudden weight loss. You will see with a fluid volume deficit, you'll see sudden weight loss, postural hypotension, poor skin turgor, and dark yellow urine. With fluid volume excess, you're going to see sudden weight gain, dependent edema, full neck veins, and crackles in the lungs.